should your cholesterol levels be? We know that cholesterol is essential for our overall health. So that means we need a little bit of cholesterol to be healthy, but we don't need too much of it. When we have too much of it, it can actually put us at higher risk for having a heart attack, a stroke. It can clog our arteries that feed our main organs. So we don't really want to go that route. Believe it or not, it can actually cause peripheral artery disease as well, where people have issues with circulation to their legs. So these are usually the cholesterol parameters that we follow. For total cholesterol, we want less than 200. And normally for LDL, which is probably the most important one that we use to determine if a patient needs medications or not, the LDL, they say they want 130 or below milligrams per deciliter. For a diabetic patient, however, we want them as low as possible. And now the guidelines are saying that we want them even lower than 70 milligrams per deciliter. So we do a lot of things to try to get the LDL as low as possible. The HDL, so H for high, we want this as high as possible. We ideally want this greater than 60 milligrams per deciliter. The higher, the better. And also triglycerides, where actually they are not cholesterol. Triglycerides are a fat, which we usually measure when we measure cholesterol levels. In triglycerides, we want them less than 150, but the lower the better for triglycerides as well. We want to keep the total cholesterol, the LDL, and triglycerides as low as possible. And we want to keep the HDL, the good cholesterol, as high as possible. For more of these videos, be sure to follow.